Zunyou, one of China's most renowned public health experts, passed away on October the 27th. He was aged 60. Wu lost his battle against pancreatic cancer, which was diagnosed during the years when he was engaged in the busy and stressful fight against the COVID-19 pandemic. Wu Zunyou became a household name as he frequently appeared on mass media, giving expertise on battling the deadly pandemic between 2020 and early 2023. Soon after the news of his death broke, many Chinese expressed condolences as they mourned the loss of a dedicated and familiar disease control expert. Gao Fu, former director of the Chinese Center for Disease Control and Prevention, praised him as a true and dedicated epidemiologist. Gao says he admired Wu's dedication to his work even while battling illness. Throughout the past 3 years, Wu Zunyou actively contributed to the prevention and control of the COVID-19 pandemic in China. In his role as the chief epidemiologist of the Chinese Center for Disease Control and Prevention, he conducted scientific evaluations of the spread and transmission of the virus across the country. Without doubt, it was a huge responsibility for medical experts like him to help contain the deadly pandemic and safeguard the health of the country's 1.4 billion people. In a TV interview conducted in early 2023, he recounted how tough the job had been for him.
What made me most distressful was making scientific evaluations of the COVID-19 situation and predicting how it would play out. The National Interagency Task Force against the pandemic would make decisions based on our evaluations and predictions. Of course, any evaluations and predictions were the results of teamwork, not just of my own efforts.
As well as the busy work behind the scenes, he frequently appeared on the mass media to give his expertise and address the public's concerns and queries regarding the pandemic. Furthermore, Wu used social media platforms to convey his knowledge directly to the public. He had more than 600,000 followers on his personal account on Weibo, a popular social media platform in China. Through the mass media over the past 3 years, people could see an aging and overworked person as his hair turned from black to grey, became thin, and his face gaunt. What made matters worse for his health was that he was diagnosed with pancreatic cancer in 2021. In January that year, he began experiencing physical discomfort but did not seek immediate medical attention due to his busy schedule. It was not until a month later that he went to hospital and was diagnosed with pancreatic cancer. The disease is a common malignant tumor in the digestive system. According to medical records around the world, the 5-year survival rate after diagnosis is afforded to just 10% of sufferers. After diagnosis, Wu soon underwent surgery. But by the summer of 2022, the cancer had spread to his lungs, leading to a second round of surgery. During this time, he lost half of his body weight. While battling with the cancer, Wu continued his busy work until January of 2023, when China downgraded the management of the COVID-19 from Class A to Class B. 4 months later, the World Health Organization announced that the COVID-19 pandemic no longer constituted a public health emergency of international concern. Summing up his work during the past 3 years, the ever-humble Wu Zunyou said in March 2023 that what he had done in fighting the pandemic must never be overestimated.
Many people have done more than me. Some of them even lost their lives as they worked on the front line of containing the pandemic. my work is not worth mentioning compared with what they did. But as I often was under the spotlight, people noticed the change of my hair and my appearance.
Born in 1963, Wu Zunyou hailed from Anhui province in eastern China. He was admitted to Anhui Medical University in 1980 and spent 8 years there after obtaining his bachelor's and master's degrees in the Department of Health. After graduation, he began working at the Anhui Provincial Center for Disease Control and Prevention. Wu pursued further education at the University of California, Los Angeles, where he obtained a master's degree in public health in 1992 and a doctoral degree in epidemiology 3 years later. He returned to China after completing his PhD and focused on the prevention and control of HIV/AIDS. He also played a role in the prevention and control of the SARS outbreak in 2003. In 2005, Wu became the director of the National Center for AIDS, STD Control and Prevention at the Chinese Center for Disease Control and Prevention. In April 2017, he was appointed as the center's chief expert in epidemiology. To recognize his work and contribution in the field of public health, the World Health Organization awarded him the Nelson Mandela Award for Health Promotion in May 2022. In January 2023, he was elected as a member of the 14th National Committee of the Chinese People's Political Consultative Conference, China's top political advisory body. As a national political advisor and a renowned epidemiologist, he has called on the younger generation to join him in the cause of safeguarding public health.
Drawing lessons from the fight against the COVID-19 pandemic, we should enhance our efforts to cultivate more personnel and experts working in the field of public health. And they should be properly trained and be prepared for any possible outbreaks of infectious diseases in the future.
With his exemplary work in public health, Wu Zunyou will be remembered, and his footsteps will be followed by a new generation of medical workers. With that, we conclude this edition of Footprints. Thanks for listening. I'm Bob Jones. If you're interested in hearing more about the lives of ordinary but incredible people in China, follow us on your favorite podcast platforms. Just key in Footprints and you can find more stories anytime, anywhere. We'll see you next time. Bye for now.